Since this is my first time, and like Liberia, recently I became First Lady, and I was a civil servant earlier, so I don't have much experience on this, and I'm really looking forward to learn from all of you. And I'm sure even now from these 2 days, I have learned a lot, and I know as a First Lady, I can do a lot better than what I have been doing before. So I'm really happy and here to be here and to learn from all of you. And one day, I'm sure, next meeting, if I'm being able to come here, definitely I will have something to show you regarding Merck Foundation and our collaboration. So, I'm so pleased to say a few words today at this prestigious gathering, the Merck Foundation First Ladies Initiative Committee meeting. As the First Lady of the Maldives, I am proud to represent my country in discussions on healthcare, especially those concerning reproductive and health and the challenges of infertility. So I think I should tell that I was working in Ministry of Health as a civil servant earlier. It has been more than 20 years since I was working, and after becoming First Lady, I had to leave my job. So this is my new thing to do. And I think Merck Foundation, I can, get from, because health is very close to my heart, and women education. So it's an opportunity for me as First Lady to exercise this. Thank you very much. In the Maldives, like many other nations, infertility is a growing concern. Despite our limited population, infertility affects a significant number of couples. So I know there are a lot of things which is very similar, like other countries in the African region. Actually, I'm from Asia region, but still we have very similar challenges in the African state as well. So the challenges might be very different from each other, but there are very similar challenges as well. Like, for example, child education, women's education might not be a very huge problem in our country. And I think I should share some, something we have some success stories about women education in our country, because our literary rate is 99%, and we have in our constitution that every child has the right to education. So in that context, none of the parent has the choice not to educate their children. So that is, I think, one thing we have done to make that our boys and girls educate. So that is the reason why today we are here. So, and also we have that, the education system in such a way that until secondary, we have free education. So even the books are being given from the government in order to educate the children. So these are the things we can learn from each other and empower. And, but then we also have many challenges, like, for example, in education, if you want to go for further education, especially for STEM, science educations, you need to go to abroad. And this is not very easy for all of us. So sometimes the government has to offer scholarship in order for that. So there are things like that that need to be actually strengthened in our country for education. Until 12th standard, we can do the free education, but then if you want to go for science education, then you need to go to abroad where you have to spend from your own pocket, so which is still a challenge for us. So these are the things we can actually collaborate with Merck Foundation and help in our country as well. But then infertility is, in our country is a country where we have very less population when compared to all of you. It's 500,000 people, an island which is scattered among the Indian Ocean. We have around 1,200 islands, where some islands is 0.5 kilometer square, so 1 kilometer square. So, the geographical distribution, it's very difficult for us to reach the islands, the rural areas, but still education has been there, but the health component we need to strengthen, because since even though we have healthcare facilities across the countries, we still have for example, NCD, I think many of them have talked about NCDs. Communicable disease was a problem in earlier status, but then right now it is shifting from communicable disease to NCDs. We have a lot of progress in our communicable disease, and where we have a malaria-free country, we have filaria-free country, and recently leprosy is also been. So there are a few things like that, but then we are on the high rise of NCD issues, where we have 85% of our deaths are based on the NCDs. So that's why, which includes cardiovascular diseases, kidney diseases, as well as, diabetes is also a very huge problem for us, and cancer, which is an emerging issue, where each and every family has now, is undergoing this. For example, even my mother died of cancer. So there are many, cancer issues has been emerging from our country, and that is something, and we have very few. We have 1 or 2 oncologists in our country, so we need support in this, and especially breast cancer is something which is very huge issue for us, because for women, in the cancer, for the women, it is the highest cancer rate is in breast cancer. So we need support in this, and I'm really thrilled to see that Merck Foundation is been helping on this, and so I'm really glad that I will get this help from Merck Foundation. And then this time we didn't bring any of our technical team, but I'm sure next time when I'm coming back from here, so definitely I will have our technical team. Yeah. Yeah, and so there are many things that I want to learn from all of you, from the foundations that you have had in your, I do not have, because I was a civil servant and I was working in the office doing nothing, and this is something so new, and I'm going to learn from you for an NGO, and I was now thinking about, okay, since my expertise is on NCD side, I should work on the NCD as well. So now I'm going to meet you, First Ladies. You have done so much tremendous work here, where I can learn and I can, exercise the same thing in my country, and I know a First Lady can do a lot. So this is something I really am taking from here, and I'm really thrilled to be here. And I would really like to thank Merck Foundation for giving me this opportunity to be here. And I think I'm the only Asian First Lady over here, but I don't feel that I am different from any of you, because we all have, in our countries, we have very similar challenges. We have different challenges, but we have challenges that we need to address. And as First Ladies, we can do a lot. And thank you very much. Thank you.
Thank you very much. I don't feel strange, because I am from Egypt, African Asian country. So it is African Asian country, so I am with you Asian, I'm here African, both. So. Thank you very much, Your Excellency, the First Lady of Maldives, and I'm very honored to have you with us, and to be a great addition and value for our platform. And we will start our long-term partnership as soon as you come back. We will connect, and we will do the healthcare capacity building and education and the awareness about NCDs and everything. Thank you very much.